have Premier Scott Moe and Dr. Saqib Shahab. Joining us on the line from Saskatoon is SHA CEO Scott Livingstone. Today we'll be taking a mix of questions from both the phone line and in the room. This is a 2-minute warning. Good afternoon, everyone, and thanks again for joining us today. In the Legislative Building in Regina, we have Premier Scott Moe and Dr. Saqib Shahab. Joining us over the line from Saskatoon is SHA CEO Scott Livingstone. Premier Moe will have an opening statement, and I believe Dr. Shahab will have some brief opening remarks as well. And we'll have time for questions. Premier?
Well, good afternoon, everyone, and thank you. And today I'm pleased to announce that Phase 4.1 of the Reopen Saskatchewan Plan will begin this Monday, June the 22nd. Phase 4.1 includes a number of outdoor sports and recreational activities. Outdoor pools and spray parks, for example, can open on Monday. Child and youth day camps are able to open this coming Monday. And outdoor sports and activities, both individual as well as a number of team sports such as soccer, softball, or flag football will be able to reconvene on Monday. And of course, there are a number of guidelines that must be followed to keep everyone safe. Those guidelines, the guidelines for these activities were released last week to give all of these organizations and everyone involved the opportunity to have some time to get ready. They include things like no tournaments or interprovincial travel for our sports teams, no handshakes, no high fives, which will be difficult. And of course, keep your physical distancing as much as possible. All of the guidelines can be found in the Reopen Saskatchewan Plan on the government's COVID-19 website. Also, as part of this phase, the limit on indoor gatherings increases to 30 people, the same as our current outdoor gatherings. Of course, even with the increased gathering size, we will still have to have enough space to maintain proper physical distancing. With the start of Phase 4.1 next week, almost all kinds of businesses, services, activities, and facilities in this province can open. We will have additional reopening dates to announce next week, and I expect to have all of the reopening dates announced by the end of this month. We are working very hard to get everything reopened as quickly as possible, but also ensuring that it is reopened as safely as possible, so that our economy can recover and more people are able to go back to work, and so that we can all enjoy the great summer activities that mean so much to our quality of life here in Saskatchewan. One of the main reasons that Saskatchewan has been able to keep our case numbers and fatality rates, more importantly, so low, is that we have avoided the kind of major outbreaks in our long-term care facilities that have occurred in many other places across this nation and around the world. This is thanks to the tremendous effort of our dedicated staff in each of those facilities and everything that they have done to ensure the safety of our seniors, the safety of our family members. Our government continues to invest in those long-term care facilities for our family members and for our seniors. We fulfilled our commitment to build 13 new long-term care facilities throughout the province, with the final one now under construction in Meadow Lake. Earlier today, we announced an investment of $73 million for the construction of 2 additional long-term care facilities in Grenfell and one in La Ronge. We're also providing $7.2 million for 82 priority renewal projects in 51 long-term care facilities throughout the province. Improvements such as new windows, flooring, heating and air conditioning, water and sewer line replacements, that's total an $80 million new capital funding that is made available for our long-term care facilities as part of our 2-year, $7.5 billion Building a Stronger Saskatchewan infrastructure plan. These and many other construction projects will drive our economy, the recovery of our economy, and thereby create many thousands of jobs. While at the same time, we will be able to deliver great new facilities throughout the province, including these 2 new seniors facilities in La Ronge and Grenfell. Today we're reporting just 1 new case, but yesterday we did see an increase in the number of new cases here in the province. Most of these cases yesterday were related to a funeral and a wake that took place last week on the Clearwater River Dene Nation. It's a reminder for all of us that COVID has not gone away, and we all still need to be careful. Our government continues to work closely with the community leaders in the area to provide support, not only in Clearwater but also in La Loche. The Saskatchewan Health Authority is working very closely with the Northern Intertribal Health Authority, or the NITHA or NITHA, to do contact tracing and testing of all of those who attended this event. We're working closely with the Chief of Clearwater as well as the Mayor of La Loche, and an action plan has been developed. A public service advisory was issued last week. Regular updates are being provided to both the community of Clearwater and La Loche on MBC Radio. And Clearwater has also implemented an 11 p.m. curfew and is restricting non-essential travel to and from the community. Groceries and other essentials are being delivered from La Loche to minimize travel. Also, trailers have been provided to the community for anyone who's having difficulty in self-isolating. Our case numbers throughout this province remain low, and that is in much thanks to the people of Saskatchewan. It's why we can continue to move forward with the next phase of our reopening plan. But we still have to remain vigilant as individuals. For COVID has not disappeared, and the case numbers do continue to rise in many parts of the world, including several states in the U.S. So with that, I will ask Dr. Shahab to make a few comments.
Thank you, Premier. So I did want to take this opportunity that as our indoor gathering sizes go to 30 and outdoor 30 as well, and as we reopen many sectors in phase 4 over the next weeks, that we just really need to remember the basics that has brought us to this place, and that should continue to take us forward. So all indoor and outdoor gatherings must follow physical distancing rules. Small, infrequent gatherings are better than large, frequent gatherings, trying to meet the same people more frequently. Outdoor gatherings over the summer are better than indoor gatherings, and obviously staying home if you're sick. This is really important because we're learning, as we learn more and more, reopening of phases, if done properly, does not generally cause transmission to restart. But gatherings in familiar surroundings, our home setting, other settings where we feel familiar with the surroundings, where we let our guard down, that's where transmission continues to happen, not just in Saskatchewan, but other provinces. So I think this is really important. And so when we look at meeting rooms and work, or when we look at our own living rooms at home, a living room where you could have 5 people sitting comfortably and maybe pull up a few chairs and have 10 people sitting comfortably, that was business as usual. Now, if you truly want to physically distance, you can't have more than 4 people in an indoor living room. And I think it's important to respect that when we're planning an event, that maybe have it outdoors over the summer. And even outdoors, if you space things out, each individual 2-meter physically distant needs 4 square meters. So you have to have quite a large space to have a gathering of 30, even outdoors. So I think it is important to think through that. And also, when there's joy or grief, we do get emotional. We try to get closer to each other. And if those people are not part of your virtual household, I think it is important to maintain that distance. And especially if people who are close to us have risk factors, like if they're older or have underlying risk factors, I think during periods of joy or grief, it is important to maintain that discipline and being considerate by being apart while being socially connected. I think that is going to be really important as we move forward, and not have the super spreader events that we saw in March, April, where if 50 people came to a gathering, 25 people got infected. So I think we just need to keep that in mind in the new normal, that maintaining that 2-meter distance as we move forward. And then we had some questions about the special exemptions for places of worship or for graduations or other outdoor events. So again, for places of worship, you can imagine a group of 30 sitting 2 meters apart. Each household is 2 meters apart, so 2 meters is quite a distance. And then each group of 30 is actually 5 meters apart. So 5 meters is a huge distance. So, you have to visualize how that would work out in an indoor space if it's a place of worship, and then extra precautions indoors if there's singing happening. Even 2 meters may not be enough, so you want to space people out, and some caution around singing. And I would say that, the recommendation, the allowed is groups of 30 up to 150 if space allows. The recommended still is virtual, so there shouldn't really be a compulsion to attend if you don't feel comfortable or feel you have underlying risk factors. And I think we all need to understand that. And similarly, if there's a graduation or other special event, same principles, outdoors, groups of 30, 2 meters apart between households, and each group of 30 separated by 5 meters. So those are huge distances that we need to visualize. Is that how things are happening? And if not, we need to adjust ourselves to make sure that that distance is there. I think that, again, will be essential for these special events to happen in a way that doesn't result in further transmission. And finally, I just want to say that, this element of social pressure, that if our loved ones come either to celebrate or grieve, it's really important to make everyone feel safe while everyone is together, maintaining that 2-meter separation while being socially connected during periods of happiness or grief. And while sometimes this does feel strange that you're sitting 2 meters apart at home or in a place where you're familiar and where previously people would sit closer together, I think having that awareness is going to be key as we reopen and enjoy many of the things we used to enjoy, that we can now again re-engage in, but still keep transmission numbers low. Thank you.
Thank you, Doctor. Thank you, Premier. We'll take our first question from the phone line.
We have Phil Tank with the Star Phoenix.
Yes, I'd like to ask about the rise in cases in Saskatoon, whether you could tell me anything about if they have any commonality. I guess I'm specifically interested in the big rally they had here, like 4,000 people. I know there have been rallies elsewhere, and there wasn't a lot of physical distancing at those, but there were mask wearing. So I'm wondering if any of your advice has changed about wearing masks, outdoor versus indoor, any of those issues.
Yeah. So thanks. So I'll speak to several of those separately. So first of all, we look back 2 weeks in every jurisdiction, and we're really interested in what's happening in the last 2 weeks. Obviously, we have the overall case numbers. And yes, we did see a bit of an increase in Saskatoon, and we did have detailed discussions with our public health colleagues, medical health office in Saskatoon. And so far, all the cases are accounted for. There aren't pop-up cases happening all over the city, which is important. There were cases linked to 3 now linked to international travel and further transmission within the household setting. So while they were in quarantine, there was further transmission limited to the household. So that is about 7 total cases. And then a further few cases linked to either exposure within the province or outside the province to a known case, and some limited further transmission. So most of the cases are accounted for, and that's important. Like you said, testing, case contact investigations, if you can account for transmission, that gives you some reassurance. and then 3 further cases are under investigation. But that is important. Whenever we see an increase in cases, we need to investigate. If we can link the cases to one another, account for them, put in further measures so that we interrupt further transmission, that is what we want to see going forward. Regarding protests, we have and will again remind that if you were at an event where you may have been closer than 2 meters or may have passed things back and forth, do monitor yourself for 2 weeks. Do seek testing if you feel unwell so that you can protect yourself and others who are close to you in a household or virtual circle. But so far, we have not seen any transmission linked to that. And I think that those principles will be important going forwards because we need to watch new cases wherever they occur in Saskatchewan. We understand that there will always be pop-up cases and they need to seek testing and isolate. If you have any symptoms, isolate yourself, seek testing, and then hopefully that will remain sporadic cases and not become larger transmission events.
Follow-up, Phil?
Yeah, I'm just wondering, what makes you confident with Monday as the reopening for pools, splash pads, and that sort of thing? What made you settle on that day?
So, why did we go for Monday?
Yeah, why do you consider it that safe for so many things to be returning, like outdoor sports, that sort of thing?
So in general, things are quiet in Saskatchewan. There's a range of activities under phase 4. So outdoor activities are starting next Monday. But then there's a whole range of other activities that will open in in weeks following, and the dates for the other activities, as will be announced later this week or early next week. But next week, a lot of the activities are outdoor activities. We feel outdoor activities, if guidelines are followed, are fairly safe, and obviously, there's a big desire to engage in some of those. So, pools, outdoor spray pads, teams who can start at least training. I think that will really give opportunity for many people who are looking for this opportunity over the summer to start participating in that. And we feel, there's never a fixed date going into something, but right now we feel, 22nd June is a safe time to start all of this.
I would just say to that, Phil, as well, it's always our goal to open up as much of the economy, the capacity we have for surgeries in our healthcare system, as well as much as we can in community activities that we have. The goal is to open up as much as we possibly can, but do so safely. The second goal, and well, probably the primary goal actually, has always been as well to flatten the curve of COVID-19 here in the province. Not to eliminate the virus. I don't think that's a realistic goal. But to flatten the curve so that we can ensure that whatever we are faced with respect to the healthcare capacity, the carrying capacity of our healthcare beds due to COVID infections, that we're able to manage that. That's always been the underlying effort here in Saskatchewan, and to more importantly, keep our fatality numbers low. We've been able to do both of that. Our infection rates are 78% below Canada's infection rates. Our fatality rates are 95% below Canada's rates. We've been able to do that while keeping 87% of the people working here in the province, leading the nation in the number of jobs that have been able to be functional throughout addressing this pandemic and keeping our numbers very, very, very admirable. As we move forward, we feel that we're able to open these sectors of our community, of our economy, and keep people safe and protect our most vulnerable, and our most notably in our long-term care homes. We know that by far and away the large number of fatalities in Canada has come from our long-term care homes, and we feel we have active measures in place and measures that are showing results that are protecting our family members, our seniors that are in those long-term care homes, and there's no more opportune time for us to thank the individuals that are taking care of our family members in those long-term care homes for the effort and the initiatives that they are undertaking each and every day.
And we'll take a next question on the phone line.
We have Guy Quenville with CBC.
Thank you. Last week, you announced the new guidelines that will incrementally allow events like funerals to take place with as many as 150 people. Now, that was the same day that health officials flagged the wake and funeral in Clearwater, which has now been linked to more than a dozen new cases. I know that the Northwest is in a different phase and under different restrictions right now, but does what happened in Clearwater give you any pause about relaxing the funeral restrictions everywhere else in the province?
I would just begin, and I'll turn it over to Dr. Shahab after just a very brief comment around, large public gatherings are a challenge. In saying that, we feel that there are some larger gatherings that can occur safely if all of the other public health recommendations are put in place, the physical distancing, the breaking into groups of 30, the if you can do an outdoor gathering rather than an indoor. When you combine all of these public health recommendations together, there is an opportunity for a safe, larger gathering. I don't know if that's all the case in the spread that occurred here, but we are confident that we're well into our testing and contact tracing of this particular event, and we hope to have it under control very quickly. Anything to add, Doctor?
I would just say a couple of things. One is that if there's an allowance to have a certain event up to a certain number, like an indoor-outdoor gathering of 30, or a special event like a worship service or a ceremony or a funeral, which can be up to 130, I think the guidance is there that will minimize the risk. It will not eliminate the risk. But I think we all need to be thoughtful about who are we expecting to come. Can we be considerate and maybe grieve with us from home, grieve with us virtually? And if people are expected to come or want to come, we have to all work together to make it safe for them to come. I think those considerations are really important. And it is going to be challenging. I think, 2 meters is a huge distance. And if you have 10, 15, 20 people or 30 people now, certainly, you need to have the space to have 30 people indoors. And if you don't have the space, I think it's important, to limit the number of people you want to come, either if it's to grieve or to celebrate. And again, outdoors, you really need to measure the space out. And that will not eliminate the risk entirely, but that will minimize it. And secondly, a lot of the larger events, there's no recommendation for any food to be served or any other items to be handed back and forth. But certainly with 30 indoor-outdoor gatherings, if food is to be served, I think a bit of thought to that as well, because having food plated or single serve is important, because again, we've learned with our mass transmission events and from other jurisdictions as well, that's when transmission can also happen when people are close together, either emotional, hugging, or when there's, they're taking food from a common platter, for example. That's when some infection happens, because we're not maintaining that 2 meter separation or touching items that others are touching right away. So I think we really need to be a bit mindful of those things and be considerate for each other when we're planning these events in terms of who do we expect or want to come, and who can we say, given the circumstances, maybe join us remotely at this time.
Follow-up, Guy?
Yeah, thank you. Before this most recent outbreak, officials in Walash and Clearwater had been hopeful that region could enter phase 3 because they're sort of behind the rest of the province. My understanding from what you've said in the past is that such decisions about moving into a new phase are made together between the province and local leaders. But I'm wondering if you can talk in a bit more detail about how that decision would be made about when Walash and Clearwater could enter into phase 3.
So generally, in the Northwest, for most jurisdictions, they can have the same gathering sizes that apply in the rest of the province with the spacing and distance recommendations. But especially in a community, if there has been a transmission event, some precautions may apply, and that would be upon the recommendation of the local community leaders and the local medical officer of health. And we will obviously support those cautions if there's a transmission event in the local communities, as there may be in 1 or 2 communities in the Northwest currently again. And again, we have to understand that those transmission events can happen anywhere in Saskatchewan, and we just need to support individuals and communities who are in that to just recover from that over the 2 to 4 weeks, make sure that any further cases are isolated, their household contacts are isolated, and hopefully within 2 to 4 weeks they come out of that, and things can restart again.
We'll take our next question from the room. Arthur?
I just wanted to focus on the new amendments that were just adopted for Bill 194, which, as I understand, sort of bans cities and towns from banning handguns. I was wondering whether that fits into your autonomy push, like some of the other firearms moves that you previously introduced. And what kind of engagement you've had with the federal government about basically undercutting a key part of your election platform.
Undercutting the federal government's election.
The promise that they made,
Okay.
right? In
Yeah.
2020.
Well, with respect to the opportunities that we have to exercise the autonomy on behalf of the people of the province, in this case, a law-abiding firearms owner, we will take every opportunity that we can to ensure that the status quo does remain. Given that this is in federal jurisdiction, they have chosen to make a decision to move forward on a essentially a firearm ban that is expanding day by day by stealth on their website, and that's extremely concerning. It's extremely concerning, not only the introduction of this ban, the fact that they have not consulted with provinces on this ban, and certainly haven't consulted on the expansion of the firearms that are being added to the ban as we go through the number of days. So we've introduced Bill 194 that essentially will not give municipalities the opportunity, as the federal government has indicated they would like to, but not give municipalities the opportunity to put in their own firearms bans. And what this prevents is a number of things. One is it prevents a patchwork across the province, so that we don't have different rules in different municipalities. The second is it does take us another step towards ensuring that we are not only protecting the right of law-abiding firearms owners here in the province, but we are doing right by the Saskatchewan people. This law-abiding firearms people are not the issue, and I've indicated this to the federal government. The issue is combating illegal gun crime in this nation, wherever you are. And illegal gun crime in this province, at least, is by far and away firearms that are acquired by stealing them, or firearms that are smuggled. So either stolen or smuggled firearms into the province. Approaching and banning legal firearm owners is not the answer to the problem that we have. The analogy would be, well, I'll leave it there. I'll maybe use the analogy in the next.
Follow up, Arthur?
We'll see if it fits with my follow-up question. I know that you're talking about the need to avoid a patchwork here, and I'm not sure if there are any cities or towns right now that have indicated a desire to make use of that option, but I mean, it could theoretically happen with new councils being chosen in October and the month after that. And I'm just wondering why the need to avoid a patchwork should trump the choices of a democratically chosen council to protect its citizens as it sees fit.
Well, the provincial government is democratically chosen as well. So we've chosen to represent the law-abiding firearm owners here in the province, since they do not have a representation in the federal government at the current point. You said earlier that the federal government has ran on this. Saskatchewan people have solemnly rejected the platform that the federal government had put forward. The current minority federal administration, in fact, they didn't receive the majority of the votes across the nation. This is not effective policy when you go after people that own firearms, when the real problem is the stolen and smuggled firearms that are in Saskatchewan, and I would put forward quite likely a similar challenge across the nation. The analogy that I was going to use is if you have a problem with vehicles, for some reason vehicles are being used in robberies or anything of that nature, quite often and that is a problem that we have across Canada and most certainly in Saskatchewan. The The answer to that is to not ban people from owning vehicles. The answer to that is to increase the fines and the penalties for people that are stealing those vehicles. It's not the owners of the vehicles that are the problem, it's the people that are stealing the vehicles. Well, the same holds true in the case of firearms. It's not the law-abiding firearms owners that are the issue. It's the people that are stealing those firearms or smuggling those firearms in that are the problem. And it would be very wise of the federal government to shift their focus towards where the actual challenge is, as opposed to the people that are and have been following the laws for many years and decades now.
And we'll take a next question from the room. Steph?
Yeah, to the Premier. Will you sign on to the Safe Restart Agreement to get a piece of that $14 million worth of transfers on the table from the
We haven't
feds?
made a full decision on exactly what we will be signing on to. It appears to me the only area where there will be provincial participation will likely be in the municipal portion of that, and so we're going through exactly what that entails, what the amount would be. We would ask that the federal government would recognize municipal investments that have been made in this province that have been unlike any other province across Canada. We're very unique in the way that we have provided annual sustainable funding in municipal revenue sharing that occurs nowhere else in Canada, and even more unique in the fact that we have provided the municipal economic enhancement program, or the MEEP funding, this particular year, so that municipalities have the dollars to participate in the infrastructure projects that they have put forward, preserving the valuable operating dollars that they have. So we have funded municipalities and continue to, and are happy to do so, to unprecedented levels when you compare them to municipalities across this nation. So we would ask that the federal government take that into consideration as we have those discussions on the municipal portion. And we have asked, as all premiers have asked, for further flexibility on all 7 of the points that the federal government has put forward. There needs to be provincial flexibility, understanding the different challenges that we have. For example, in Saskatchewan, and more so in Alberta, but Saskatchewan and Newfoundland have been impacted by essentially what has turned out to be predatory pricing by other areas of the world in the energy industry, resulting in a few weeks of negative pricing margins here, negative pricing, quite frankly, here in Saskatchewan, to an industry that is a major driver of jobs and the economy here in Saskatchewan. And so we would like some flexibility to utilize some of the $14 billion, some of Saskatchewan's share of that $14 billion, to ensure that the industries that are driving our economy, providing jobs in our economy, have the ability to continue operating and be part of our recovery and growth of the economy in the future.
Follow-up, Steph?
Yeah, kind of a two-parter. Do you know how much Saskatchewan's share is currently worth? And are you saying that the deal right now is too rigid, or it lacks the flexibility?
Most of the points actually aren't federal provincial agreements. They're federal initiatives that have been put forward. I would point to some of the personal protective equipment that is being committed to, and we appreciate the initiatives that have been put forward there. I'd put forward the sick pay initiative, which will eat up a large portion of the $14 billion, and is really a trading pawn, if you will, so that the Liberal government doesn't have to go into the House and introduce a budget, being supported by Jagmeet Singh and the NDP. That essentially is why the sick pay is on the table with respect to the Safe Restart program that has been introduced here. So all but the municipal portion of that of the Safe Restart program is federal initiatives. They have no provincial input. The provinces had very little, if no, consultation, as well as very little or no input on what those parameters would be. Virtually all of the provinces, I won't say all of them, virtually all of the provinces have asked for additional flexibility when it comes to the transfer of those funds. We're in different situations across this nation with how we have handled the COVID response from a healthcare perspective. We're in different situations across this nation with how it's impacted our economy, and I've used the energy sector in Saskatchewan, Alberta, and Newfoundland as an example of how there's been a disproportionate impact in that particular sector. So the fact of the matter is we appreciate the $14 billion. We would hope there is more added flexibility to the $14 billion on how the different regions of this nation are able to utilize those dollars, and we'll await further notice. I think some of the work on precisely how the programs that the provinces actually participate in, which I think are less than $2 billion, how that will actually play out. So those conversations are happening right now. Your very first question, on a per capita basis, Saskatchewan's share on $14 billion roughly would be about $450, just under $500 million.
We'll take our next question from the room. Karen?
Dr. Shahab, do we know more about the 2 people who don't live in Saskatchewan but tested positive here?
I don't have that information. Yeah, but that we have an interjurisdictional approach where we have to reconcile the numbers so that we don't miss when we count nationally and don't double count. So we will, we may not obviously able to share the details, but there is a process where we try not to miss cases if it's someone with a Saskatchewan residence in another province and vice versa, but not double count also.
You have a follow-up, Karen? Yep. We'll take a question from the phone line.
We have Mark Smith with CTV.
Hi. Does the province have any plans to provide additional funding to schools to address COVID-19 costs, such as extra cleaning or smaller class sizes to adhere with physical distancing guidelines?
Well, in this budget that was released yesterday, there was almost $80 million additional provided to the school divisions, as well as school divisions have been experiencing some savings over the course of the last 3 months, and so we're in active discussions with them as to what those savings exactly are, and we're working quite actively with our school divisions, with our education sector as a whole, on what the parameter, and public health, on what the parameters and what the outlook is for how do we safely send our children back to school. So I would say this, as we go through that conversation and understand exactly, first of all, what those parameters are, second of all, is there additional costs, what those costs may be. They may be expanding your classroom size by possibly renting a hall in the area or something of that nature. I don't know, but those would be costs that we would look at once we know precisely what they are. But I would just say this: it is our intent that we will hopefully be able to, and it's our intent to provide every opportunity for our students, our K-12 students, to return to school in full attendance in some fashion here this fall. But we need to ensure that we have the parameters in place that are ensuring that our children are also returning safely.
Follow up, Mark?
Yes. Prime Minister Justin Trudeau stated that systematic racism is real and all Canadians need to be aware. What is Saskatchewan's stance on systematic racism? Oh,
it is. And the fact of the matter is that we have had our own challenges and conversations and continue to here in Saskatchewan, including the rallies that have been held here over the course of the last couple of weeks. But the fact of the matter is also this: by far and away, the vast majority of people in this province are welcoming. They're kind, and they treat people in the same manner that they would hope to be treated in return. If you look over the course of the last 10 or 12 years in Saskatchewan, there has been over 90,000 individuals that have moved here from over 150 countries all around the world to not just Saskatchewan and Regina, but they have moved to communities right across this province, rural and urban. And I think if you ask the vast majority of those individuals, and I've talked to many, they would reiterate that Saskatchewan is a warm, welcoming place, and we need to take this time at this point in history to just remember our personal responsibility in not only addressing, protecting ourselves from things like COVID-19, but ensuring that we are also taking our personal responsibility in the manner that we treat people. very, very seriously. And we need to always remember to treat one another with the same respect, the same dignity, and the same love and caring that we expect to be treated in return. It's a very, very simple personal responsibility, but it's one of the most important ones.
We'll take a next question from the room, Adam.
Dr. Shahab, when do you anticipate phase 4.2? Could it be happening before the end of the summer?
I think we'll be announcing the dates shortly, either this week or early next week, but certainly the remaining phases will come closely to phase 4.1.
And what feedback have you received from people on the phases that have opened so far? And what are some of the concerns that they have shared with you about things they've seen, things that you maybe have had to adjust?
So again, as I was saying earlier, a lot of these phases have had detailed guidelines developed. The guidelines have received feedback from people who would be engaged in that, from business owners, and that feedback has been incorporated to further refine the guidelines. And going forward, that feedback will still be important to further adapt those guidelines. But what we have seen actually so far is quite reassuring that an organized, systematic way of reopening the economy does not result in increased transmission. And I think that's really has given all of us confidence in terms of not just continuing to reopen, but also engage in all those sectors in a safe manner. And I think that is critical. But on the other hand, what we have seen is that when we are in situations that we are more familiar with, our own household, close family and friends who may not be part of our virtual bubble, we do relax, and that's where transmission continues to happen. So I think that's what we need to watch as we reopen carefully, consistently, and follow the guidance that's developed based on public health principles and science. We also have to watch for settings where we're more familiar, more relaxed, where unfortunately we continue to see clusters, and that's what we need to manage. Not that we will never have clusters, that will happen, but it's just to make sure that we keep them as infrequent as we can to keep our curve flat.
And we have our last question on the phone line.
We have Dominic Lusick with Relco.
Hi, Dr. Shahab and Premier Mo. I just wanted to ask, with pools and certain sports opening up on Monday, will there be any type of restrictions on what you'll be able to do, in the pool, or will there be any kind of changes to the sports that you'll be allowed to play?
Well, I won't be synchronized swimming, Dominic, but Dr. Shahab might have some further restrictions that would be just as important as me not synchronized swimming.
Yeah, I think the guidelines have some basic precautions around, how many people can you have within an outdoor pool, and the operators will have to decide on a limit, and some special attention around, washrooms, more cleaning of multi-touch surfaces. Beyond that, we know that if you're outdoors, if you're maybe in chlorinated water, otherwise, if you're with your close household members or friends who are part of your bubble, obviously you can be closer than 2 meters, but not that, otherwise just maintain some distance with people who aren't part of your virtual bubble. I think those principles should apply in pools and playgrounds and splash pads. And then with sports teams, going back to training again, outdoor activities, day camps should be fairly safe. Observing some of those basic principles, that's also a good training for when school starts. The day camps are a good training for when school starts. And we'll see, we hope that transmission remains low because they're outdoor events. And again, we don't expect to see anytime soon, lots of tournaments where there's travel throughout the province or travel within provinces happening. And I think that's what we just need to watch for as well, that, staying local, staying within your, group of people who are engaged in a certain sport locally, I think is a safe way to move forward. And we have to realize that occasionally if there is a transmission event, testing is easily available. Seek testing, get tested. Most people, especially if they're young, it's a mild illness, you recover. But why testing is important is that so you can isolate, your close household contacts can isolate, and you can protect people at higher risk who may be your parents or grandparents or others with underlying medical principles. I think that's what we all need to remember as we re-engage, as our children re-engage, that, take advantage of, access to testing, and then staying isolated if you do have COVID, and not be surprised if really a transmission event happens. I think we just need to understand that may occasionally happen, and we just need to understand and accept that.
Follow up, Dominic?
Yeah, another question. Do you know when we'll start getting more info on the location and just more details on newer announced cases, like for instance, which community they're in, that sort of thing?
So obviously, when there's a transmission event, and there's a need of a public service announcement, that does happen. Having said that, we have looked at various geographies. We looked at former RHA boundaries. We looked at trading areas. Certainly, the SHA is one big provincial geography, and we do report by far north, central, south, Regina, and Saskatoon. That's been useful so far. We do look at small geographies when there's a transmission event, but if there's no concern, we don't speak to that, and if there's a concern, we will speak that there's a transmission event in a small community or number of communities, like for the Northwest that happened. But we'll have to refine how we look at that data. Currently, we are looking at data at a fairly granular level, but things are pretty quiet, so there's nothing much to report. But obviously, if we saw more transmission happening, and there's a need to report to the public, and that may be relevant, for example, for school divisions or other settings where there's transmission linked to a certain activity, that people need to know that within this area, maybe we need to slow down this activity. We will be starting reporting at that granular level. But at this point, I think you need to appreciate that with very low number of cases, apart from small clusters that we do speak to, even as we did today, there's nothing much to report. But having said that, we do want to make sure that testing is happening at a granular level. Testing rates are up, and when we look at the small geographies, that is the case. And our test positivity rate remains low, which again, when you look at our test positive rate overall and by smaller geographies, that is reassuring. It's low. And of course, we look at a provincial level, because those thankfully have been rare events. But we also always look at ICU admissions and hospitalizations, which remain very low, because if our total case numbers were low, testing rates were low, but suddenly we saw an increase in hospitalizations, we would be very concerned, because that would mean that we're missing transmission, and people are only showing up with a 2 or 3 week lag in hospital. So far, all the indicators are reassuring, they're low, but as we go through the summer, and especially as we enter into the fall, we'll have to continue to watch cases and clusters closely, look at all the other parameters, testing rates, test positivity rate, hospitalizations, ICU admissions, and continue to communicate that in as much granular detail as it makes sense. And at this point, the large geographies that we have, far north, central, south, Regina, Saskatoon, seem to be appropriate, with, of course, further details when there's a public service announcement due to an exposure event or other reason to communicate publicly about clusters when it's beneficial for people to know, because it may impact them because they may have been to that event, or it may impact them because there may be some change in what you can do within a certain portion of the province.
I think if I could just add to that, Dominic, there has been public service announcements where there's been some minor outbreaks. We just had one in Clearwater. I believe there's one in Saskatoon a few weeks ago. And it's important as we have those and have these clusters, and we will continue to have these until such time we have a vaccine, to understand a few things. One is we do have the testing and contact tracing capacity to isolate and manage these clusters, and we've shown that time and time again, and it's important for us to continue to ensure that capacity is available and quite likely grow it as we open our economy, open our communities, and open our healthcare system. Second is, this is a good time for us. We haven't talked about it in some time, but how we function each and every day as individuals and as a community needs to be congruent across the province, regardless of whether you have a cluster in your community or whether you don't. We need to practice good physical distancing. We need to ensure that you are washing your hands. If you are not feeling well, you need to stay at home. And we have the self-isolation support program that can help some individuals financially through that. Outdoor events are better than indoor events. We need to be kind to one another. If a family or an individual is not feeling comfortable in attending an event that you're putting on, we need to allow them to not attend that event and not be judgmental. This is a time where we have different levels of comfort in our families, in our communities, and And we need to allow people to have those different levels of comfort. We may not know if they are visiting someone that is immunocompromised or an elder in their community on a regular basis and just aren't comfortable expanding their contact reach. And we need to do all of these things, regardless of whether there is an active outbreak in our community or whether there isn't, because there may be, and quite likely could be, between now and such time that we have a vaccine, and we need to ensure that we're protecting not only ourselves but our family, and most importantly those that are immunocompromised and our elders in our family and in our community. And we can do so by adhering to these recommendations that have been put forward for the next number of months. So with that, thank you everyone for coming today.
Thanks very much, everyone. That concludes your time.